Hello everybody, myself Dr. Gayathri Reddy Patlolla, Consultant Fertility Specialist at Cloudnine Hospital, Hitech City, Hyderabad. As such, there is no limitation for the number of IVF cycles a couple should undergo. But each failed IVF cycle puts the couple under a lot of emotional, psychological and financial stress and strain. But that doesn't mean that the couple should give up after a single IVF failure. When we examine the various studies on how many IVF cycles or how many IVF attempts a couple can undergo, many of the studies suggest the 3 cycles of IVF would be an optimum number of IVF cycles that a couple can undergo, taking into consideration the financial, emotional and the physical strain that they go through during these IVF cycles. But putting aside the financial constraints, many of the studies also show that the success rate of pregnancy increases with the number of attempts. So is the personal choice of the patient, and the couple has to take a conscious decision taking into consideration the emotional, financial and the physical strain that they are undergoing after 3 cycles of failed IVFs. Then coming to the minimum gap that is required between 2 IVF cycles. Minimum gap of around 4 to 6 weeks is what is recommended, with 1 menstrual bleeding in between, and this is the minimum gap that needs to be given between 2 IVF cycles, and this is considered as back-to-back IVF cycles. Only when it is delayed beyond 1 period in between the 2 IVF cycles, then it is called a delayed IVF cycle. But as such, there is no difference in the success rate with the increase in the duration of gap between the 2 IVF attempts.